You may have heard of astigmatism, but you may not know that it hinders your vision. Luckily, there are options to correct the condition. Dr. Jeffrey Whitman of the Key-Whitman Eye Center is here to explain new and effective treatments available if you have astigmatism. And it's common, so this is of a lot of interest. Okay, for people who aren't familiar with it, what exactly is astigmatism?
Well, astigmatism is, and I brought some little visual.
I love it when you show us like that.
It's something to make it simple, but simply put, astigmatism is an imperfection in the shape of the front of the eye, the cornea. So normally it's round like this round ball, okay? But with astigmatism, you have an extra curve to the eye that makes it maybe more like this football. But either by optical means or surgical means, if we correct the astigmatism and get rid of that extra curve, it brings it back into round, kind of like this, making it like a round ball. So we can correct astigmatism.
So how do you know if you have it?
Well, you know, that can be very different for different people in that with a little bit of astigmatism, you might just have a little blurry vision along with your nearsightedness or farsightedness. But if you have a lot of astigmatism, you're very likely to notice some doubling or ghosting of images. The important thing to remember, if you're getting blurry vision or any of those symptoms, you really need to call Key-Whitman, come in, and let's get it measured.
Okay, so you mentioned a couple of things. You do have technology at Key-Whitman that can help astigmatism.
Absolutely. We have high-tech instruments now that can precisely measure the amount of astigmatism and where it is. That's important too, because it can be in the front of the eye, it can be inside the eye. We need to know that so we can recommend what treatment is right for your eyes. So
I don't know where I got this idea, but somewhere along the way, I thought I heard that astigmatism couldn't be treated, but it can.
Well, unfortunately, we've heard that more and more, and I think it's because of people that don't treat it.
Okay.
Perhaps perpetuate that myth. But, you know, and in the past, the only way we could treat astigmatism was glasses and contact lenses.
Right.
But at Key-Whitman, we've been treating astigmatism with the laser and LASIK for over 15 years now. So yes, it's very treatable. In fact, with our newest laser, we can treat higher amounts of nearsightedness, farsightedness, and astigmatism than ever before.
What about people who have cataracts and astigmatism?
That's a very good question because many cataract patients also have astigmatism. And what we have now are what we call toric lenses. And here's a very enlarged lens. Obviously, this is not what we'd use in the eye. They're microscopic. But it has an area of curvature to correct astigmatism built right into the lens implant, so we can correct astigmatism with the laser, with not just the laser, but with the same time we do cataract surgery, the lens implant takes care of the astigmatism and the vision. In fact, these toric lenses, and that's what they're called, can be combined with our high technology lenses like Symphony and Crystalline, so we can get that more perfect vision distance, intermediate and close up, all distances.
So what's the best way for someone who thinks they may have astigmatism to find out for sure?
Well, you know, that's the easy part. Just give us a call at Key-Whitman and let us know what kind of problem you're having. We'll have you in, we'll do all the measurements so we can tell you what kind of astigmatism you have and the best way to treat it. And
you have several locations all over the area.
We have 9 locations now all over North Texas. I and my team are at the main headquarters location off of 75 North Central between Royal and Forest Lane. We'd love to see you. Come on in, pick up that phone, give us a call, because at Key-Whitman, we want to help you see better.
Okay, and to call for an appointment, the number to call is 214-220-EYES, 214-220-3937 for the Key-Whitman Eye Center, or go to keywhitman.com for more information on services and on procedures.